Hey everyone, welcome back to Simply Shana. Today is just gonna be like a little video, maybe a quick 5 minute just to update you guys with what's going on. So the first thing we're gonna talk about is I think the dosage calculation, what I like to call nursing math. So we took that like maybe almost 3 weeks ago now. Took it. That's the math that I say if you can't pass it, you're not able to move forward. Like you have to wait again next quarter if they let you back in, and then you try to redo it. So we took that. Maybe it's been probably 3 weeks now. So the first time I took it, I felt it. Like I felt bad. I'm not gonna tell you guys what I made, but it was pretty bad, like bad, to the point where I walked out of the classroom and then and cried. I cried about it. But yeah, I cried about it. It was bad. Like I was embarrassed. Nobody else, like it's like nobody saw my grade, but just maybe the professor. But I was so embarrassed because I thought I knew my thing. I thought I knew what I was doing because I was over there busy on ChatGPT, practicing instead of me practicing what the resources the school provided us on like in the Canvas. I was busy with ChatGPT. Yeah, that happened to be my new best friend with studying. I was busy with ChatGPT, like, and I learned ChatGPT is good if you're using it the right way. You can learn a lot of stuff on it. But yeah, I failed the first time, and then I went back. When you fail, you go back and like you meet with the director, and like just you go over like what you got wrong, and then like they give you another packet to practice. So when I got that packet, I practiced. I think it was like 30 questions in there for the practice. Now the exam is only 10 questions and you have to get a 90%. So when I got a packet, I just kept practicing. Even after I didn't, I got everything right in the packet, and I kept going back and just practicing, like reinforcing, just to make sure that I'll be okay. So when I went back and redid it, I got a 90, which is what we need. That's the minimum we can score to be able to pass it. They gave you we get 3 attempts, and that was cool. So I did get a 90, so I don't have to do a third attempt. I'm happy about that because it's pretty much like it's nerve wracking. Like imagine you have like a 10 question like problem thing, math that can either make or break you, because if you don't pass it, you can't move forward. It doesn't matter if you have 100% in your like in the class, you cannot move forward without passing dosage calculation. So if you're in nursing school, that's something to focus on, because like let's just say, I'm not telling you not to study for your exam, but if you kind of fall back on one exam, you can't you can study and try to catch up, but if you don't pass your dosage, you cannot move up. So it is what it is. So I did that. I'm done with that. And then that week I think we did like 2 exams that week as well. Or was it? Maybe not that week. I don't know. I don't remember. And then after that, I had like a med surg and pharmacology exam. I passed. I didn't get a 90 or anything, but I got a good grade. I'm happy. I was happy with my grade. That's done. We had an IV. So we had like 2 CPEs that we had to do. That's where like your clinical skill. With the first one we did was an IV insertion. When I tell you, I was so nervous. I was shaking and all over the place, because that week, the week we had the IV insertion CPE, like we had 2 exams that week, and then like you had to, oh yeah, that was the same week with the math. So I was just say that we have 4 exams that week. I'm gonna count everything as an exam. The math was definitely important. That was an exam. Med surg and pharm. Then we got the IV insertion. That's a skill you still have to remember. Like you still have to go over like the scenario, how to do it, how to prep everything, put it in, make sure when you're doing this one, you can remove the tourniquet and all that stuff, how to put in the needle, how to like advance the catheter, pulling out your needle. You still have to learn those things. So I did that. I was nervous. I was shaking. So I realized that just made me, I mean, I've already, like, I do know that I have issue with my anxiety, but that just reinforced it. I was so nervous, but I did it. That's dead and gone. Then we had the second CPE was IV med push. I went in there. I wasn't as nervous because when you walk in, you get to you have a professor that you do it with. So when we walk into the lab, you go there, they give you your order, you kind of read your order. You don't have to read it aloud, but you just go over that scenario that's in there, what's going on with your patient. And then you, based on that scenario, they have a couple of medications on there. So you decide what does your patient need based on what you just read. Do they just need like pain medication? Is it like a routine medication that they just need? So you figured out that stuff on your own. You tell them, okay, based on what I just read, this is what my patient needs. And then you go and pick up that medication file, bring it back. Now you have to know like your doctor's order. That's where the dosage calculation comes in. So you have your medication now. You're looking at your doctor's order. So you have to try to figure out how to do the math so you can like kind of figure out how much to give your patient. So that's where the doses come in. So did that. I passed that one. I wasn't as nervous, but with that, you have to, even if you just know how to do the math, pour the medication, you know how to do the whole like cleaning the IV and giving the medication. And like with the IV push, you have to know how fast or slow to push that. So that, for example, if you have morphine, you go in a drug book, the morphine, like I had morphine, like I can't tell you how long like morphine is for, but because like I'm still clinical purpose, I'm not going to tell you guys that. But you have to go in a drug book, you have to know how fast or slow you can push that. Like, is it 2 minutes or does it need to be pushed like 3 minutes or stuff like that? So did that. I passed that one. I wasn't, like I said, I wasn't as nervous. And then you have to remember to do your safety checks. Identify, make sure you have like the right patient, the right time, the right medication, all that stuff. You do that. So I passed that as well. But I think we have one more CPE coming up. That's gonna be the head to toe assessment. Like, so I thought like I've been doing that because I knew that was coming anyway. So I've kind of been practicing that. Sometimes I do it with my son or like like I'll practice on him. But I got to find out last week they added, it's not just going to be the regular head to toe. They added more. So now we have to do the 12 cranial nerves. I think the 12 cranial nerves are somewhere over here. Or I don't know. It's somewhere. So you have to know like the 12 cranial nerves and you need to know how to, first you need to know them and know how to assess them. Like the optic or whatever, that's the eyesight, and then the olfactory, that's the smell. So you just need to know how to, like, you need to know your 12 cranial nerves and then how to assess them on your patient. So that's what we have coming. I think that might be the last one. I could be wrong, but I think that's the last one. I also have an exam on Thursday that I need to study for, but I still have like maybe 2 more days. So yeah, I do have an exam on Thursday, and then next Thursday, I have 2 more exams left. When I take this one this week, one next week, and then we have like 1 more left after that. But so that's all that's been going on. But it's been a lot of like back and forth. It's been a lot of stress, a lot of working and trying to study. That to the point where like 2 weeks ago, I felt I was so overwhelmed. Like I was overwhelmed. I was tearing up. I was having anxiety, especially when I failed the math. My anxiety level was through the roof. But so I just started Googling, like, oh, how do you manage your like, how do I manage my stress level? I'm in nursing school, like, I'm stressed, I have to work, I'm a single mom. And I'm trying to Google that. And then I went on YouTube. I saw a couple of videos on YouTube. And a lot of the girls that I watched, they were writing, like, said they were praying more. So I picked up my Bible. This Bible was gifted to me, like I was gifted this Bible. I love it. Like the color is everything. So I got into my Bible. I started reading a little bit. I'm not perfect right now. Like, I know this is something I really need to work on, but I just picked up my Bible. And now, like, if I have negative thoughts going through my head, I write it down. I write my negative and the positive. I write down the negative and I write down how to change that negative to a positive. And I put it in my Bible and I pray over it. And that's been helping me. Everything else is still the same. I still have to go to school. I still have to study. I still have to work. Like, and I said to myself, at the end of the day, Shannon, you knew all this stuff was going to happen. You knew you were going to go to school. You knew you was going to be working because you were a single mom. And you're single. You don't have anybody else like helping you. So you knew that was coming. So like, what is it? But it's just that at the end of the day, we're human. You still feel how you feel. But my Bible's been helping me. Also, I also want to show you guys this. Like, if you're in the nursing program, look at this. These were gifted to me. Look at these. The ATI. I think I have about 12 pieces. So, with these, I have something. One that I have 2 of that I want to give to somebody. So, I have 2 of the mental health. So if you're at Galen Dallas, the mental health nursing 11th edition, I have them. I can give you one. Okay. Also, like I was talking about the dosage calculation, I ordered these. These really help me, and I know these are gonna come back like handy too for next quarter. Like, this is like a dosage calculation book. I have 2 of these. I ordered one. They sent me 2 by accident. I tried to return it. They told me I could keep it. It's Amazon. So, I have 2 of these I can give. If anybody, if you're at Galen Dallas and you need a dosage calculation book, I'll give it to you free. You don't have to pay for it. And my, yeah, I think that's about it. So, I just want to say thank you for watching my video. I hope you watch it from beginning to end. That's how you can support me and like and share. Okay, thank you.